My name's Megan Weigel. I'm a nurse practitioner in Jacksonville, Florida, and today I'm going to talk to you about some tips and tricks for daily life. The tips and tricks that I'm going to discuss today are actually life hacks for bowel and bladder issues. The first one that no one really likes to hear is you need to stay well hydrated, and that's well hydrated with water. So you want to avoid foods and fluids that are high in sugar, and you really also want to avoid artificial sweeteners. All of these things are bladder irritants and can make your bladder a little bit spastic and want to empty more frequently. You also want to watch your load of spicy and citrus foods because those also act as bladder irritants. Decrease your caffeine intake. Now, I know that's a hard one to hear because many people living with MS actually use caffeine to help with fatigue and energy and alertness. But caffeine also makes the bladder a little bit more spastic. So if you can, just cut back a little, maybe during certain times of the day. Maybe you, instead of sipping on coffee all day long, you choose to have a cup in the morning and a cup in the afternoon. We also know that caffeine actually can help with evacuating our bowels. So a cup of caffeinated coffee is not a bad thing. I also recommend eating a plant-based diet that's high in fiber. The fiber from plants and vegetables and fruits really promotes emptying of the bowel and having regular bowel movements. So plant-based diet, colorful, lots of fruit and veggies, and high in fiber. Some more life hacks for managing bowel and bladder issues. Well, the first one is Kegel. Kegel exercises are things that women who have had children are probably familiar with, but other people might not think that they have to do them. They're super important, and even men can do Kegel exercises. The basic premise of doing a Kegel exercise is that you use the muscles to stop your stream of urine. So the next time you're on the potty, I'm not afraid to say potty because I potty train at my house, my toddler. The next time you're on the potty, go ahead and start your stream of urine and then try to stop it. These are the muscles that you want to activate when you're doing Kegel exercises. And you can do these any time of the day. You can do these when you're at a red light. You can do these when you're watching TV. You can do these when you're in a boring conversation on the telephone and you think you'd like to exercise. Just exercise your pelvic floor muscles. Speaking of exercise, it's also really important to move your body daily. Moving your body helps promote bowel movements. You can talk to your healthcare provider about medications for constipation, but many times people can manage constipation with just changing some lifestyle things. You can practice timed voiding to manage bladder issues. And timed voiding basically means that every few hours you just go to the bathroom and you try to evacuate your bladder. And that way you kind of get into the habit of not, oh my gosh, I gotta go now, and then you have an accident. Just know that every 2 to 4 hours you're going to try and go to the bathroom and evacuate your bladder. Similarly, you can plan time for bowel movements so you don't feel rushed and stressed. When a person is stressed, everything clamps down, and that includes the muscles of your bowel, that includes your intestine, and so you really should be relaxed in order to have good bowel movements. So don't try to rush it. If you struggle with constipation and time, then just give yourself 20 to even 40 minutes to try to have a bowel movement in the morning, and let it be not a stressful ritual. Maybe you take a podcast to listen to, or you take a book that you're reading, and you just settle in and let your body do what it already knows how to do. Intermittent self-catheterization is a technique that is used for bladder management, often when medications are not effective. And when people hear that this is a possibility for them, it almost runs the same line as maybe you should think about using a power chair. People don't like to hear that intermittent self-catheterization might be helpful for them. And like suggesting using a power chair or a scooter, many people find that when they start to use ISC, their lives open up. So it's a clean procedure. It does require appropriate hand function and sensation as well as cognitive function. Support partners can be helpful for ISC, and the most common risk is urinary tract infection, and that's usually related to either not having clean enough procedure or not cleaning equipment well, or perhaps not having great dexterity. So it's really important to follow clean procedures and have enough equipment. If you struggle with bladder frequency, bladder urgency, or just incontinence in general, ISC can be a great measure to help you before you go out to run errands, before you go on a car trip, before you go to exercise, or on an outing with your family or friends. These are some pictures of intermittent self-catheterization tools. These are actually the catheters themselves. The size is dependent on your anatomy. The catheter itself goes into the urethra of either the man or the woman, and then the urine drains out into a bag. So it's a pretty simple procedure. It can be done in a restroom. It can be done in bed, it can be done in a chair, it can be done wherever you're most comfortable. Really does, again, open up life for a lot of people. So I like to think of this, you may have figured already that I like to think of this as a mobility device. It promotes bladder health and actually less risk for infection, loss of muscle tone in the bladder that's used to getting big and bloated and then can't empty. And it also promotes the muscles of the bladder to be less spastic. So as a person living with MS, your bladder may not empty all the way as well as it should. And so you've just got a little bit, let's call it a puddle, a muddy puddle of bacteria in that bladder, even if you think you're emptying it well. Intermittent self-catheterization can help empty the bladder all the way, and therefore can decrease the risk for chronic UTIs. It also improves your emotional health. There's less worry about accidents, and you have more control over the when, the where, and the how of your daily activities. It improves freedom and independence as well. So you can, like I mentioned already, use ISC before outings, and you can also use it before going to bed at night, taking a nap, before sex, or before exercise. So reducing bladder and bowel complications is just a really big part of living with MS. You shouldn't have to tolerate bladder symptoms. You shouldn't have to say, oh, I have them just because I have MS, or if you're a woman living with MS, oh, everyone my age deals with this. And if you're a man living with MS, oh, it must be my prostate. Really don't tolerate bladder symptoms. Make sure you talk to your healthcare provider about them. Your MS provider may choose to refer you to a urologist or a urogynecologist for more specific help. In summary, I've given you many tools to help reduce the complications of bowel and bladder function when you're living with MS. The first step is to talk to your healthcare provider, specifically your primary care provider or your MS provider. Ask for a referral to urology or to gastroenterology. The second step, and often the first step in bladder and bowel management before medication, is pelvic floor therapy. Physical therapists can be certified in pelvic floor therapy, and the tools they give you to help you regain control of the muscles in your pelvic floor are really helpful for managing bowel and bladder issues. The third thing to do is not to restrict fluids. Make the majority of your fluids during the day water. When you restrict fluids, you actually encourage constipation. The stool in your intestine presses on your bladder and causes incontinence. So don't restrict those fluids because you're going out on an outing with friends or family, or because you're exercising, or because you're going on a car trip. In fact, you're doing yourself more harm. Keep your bowels and your bladder moving by drinking lots of water. If you're using a catheter to manage your bladder, make sure that you follow the instructions for proper cleaning and storage in order to reduce your risk of infection. And if it gets to the point where you need to take medication to manage bowel or bladder issues, know that that's okay and can become part of an excellent plan of care. I hope these life hacks help you and that you have a great day.